Namaskar, I am Dr. Sucharita Chakraborty, Consultant Nephrologist at Care Hospitals, Bhubaneswar. Today we are here to touch upon a very important topic. This is especially for patients of chronic kidney disease who have been recently advised to start maintenance hemodialysis, that is hemodialysis for twice to thrice per week. So it's important to understand that the moment you start hemodialysis, that is maintenance hemodialysis, your diet, your water intake, your medications will go through a certain number of changes which you should be ready to understand and accept, because most of the patients who come, they have been under strict protein restriction or strict non-veg restriction, water restriction for a very long time. So for them to change their diet, it takes some time mentally as well as physically to accept. So what we need to understand here is, before dialysis, when a patient is not undergoing dialysis, in a patient of chronic kidney disease, they are advised for strict protein restriction in their diet. So the diet that we give you is with very minimal protein intake, along with water restriction as per your clinical status, that is the amount of urine you are passing every day, the status, if you are swollen up, if there is swelling of legs, hands or face. So depending on that, your water intake and protein intake and diet is advised. Like there is restriction of fruits in your diet. So once you are starting on hemodialysis, there are certain functions that are being taken over by the hemodialysis, that is, it is a blood purification process in simple words. So the extra fluid that the kidneys are not being able to remove, in dialysis we remove that extra fluid. Also the waste products like urea, creatinine, sometimes you may have high potassium in your blood. So these extra electrolytes or waste products burden that the kidneys are not being able to remove, that is done through dialysis. So once you start on dialysis, there is a more liberal intake of protein that is allowed. So you will have to increase your protein intake, that may be in terms of in vegetarian foods like in dal, paneer, milk products. Also in non-veg, some animal protein may be accepted and allowed also. Along with that, the water intake, there is a little more liberal intake of water that is allowed. So also some medications, there are some medications that are changed, some medications that will be stopped. So you need to listen to your nephrologist, consult your nephrologist when you are starting that once you are advised for dialysis. Whatever is prescribed by your nephrologist, by your dietitian, please be willing to follow that to be in the best of your health and to improve the quality of life that you are having.